From those Canadian wildfires continues to drift into the Mid-Ohio Valley. Medical professionals warn that some residents here are more vulnerable to its effects than the national average. WVU Medicine Camden Clark pulmonologist Dr. Rojan Matthew urges people to pay close attention to the air quality index, not just the sky outside. He says once the AQI climbs past 150, sensitive groups should start taking precautions. If it climbs into the 300s, he says the air is seriously hazardous and that everyone should stay inside or away from the area whenever possible. The most sensitive groups include children, older adults, and anyone with existing heart or lung conditions. Matthew says many people in the Mid-Ohio Valley fall into some of these vulnerable groups.
In this region where we have a lot of chronic lung diseases and also we have a lot of people who really smoke quite a lot than the national average, we are a more vulnerable population, especially if you have hazardous material and smoke around in the region.
He said mild symptoms like eye, nose, and throat irritation can escalate to coughing, wheezing, and increased inhaler use the longer someone is exposed. He says once the air quality index passes 300, it's time to bring out N95 masks and air filters. He notes that cloth and surgical masks will not filter out the small particles in wildfire smoke. He says clear-looking skies does not mean the air is actually safe, making it extra important to check that air quality index.